Hey everybody, Luke here, and today we are continuing our discussion about knee pain. And in this video I want to give you more of an introduction to the knee itself so that you can understand the anatomy and the basic structures that are involved with the knee that can oftentimes be associated with knee pain. So that's what we're going to look at, 4 basic topics today in terms of different structures that are involved with your knee. Again, orienting you to the structure and anatomy of the knee. And then at the end of the video I'm going to talk to you about the most common cause of knee pain. So let's get into those major things. So first off, with the knee, you've got your joints. And I say joints, a lot of people think of the knee as just one joint. There are actually 3 joints in your knee. So there are 3 joints. Don't really know what that is there. That's a star, I guess. So there are 3 joints in your knee. Most commonly, people think of the knee as the main joint that just bends and straightens. So coming down at your thigh, you have your femur. Coming up from your ankle, you have your tibia, which is basically your shin. So that's your main joint, and I'll try to draw a little picture here. Maybe go around the word pain there. And so basically, if you have your femur coming down, well, let's just kind of make it look a little bit like that, kind of like a dog bone there. So the femur comes down, the tibia is here, like that. So again, that's your main joint people think of when they think of the knee. It basically has 2 compartments. If you look at the end of the femur, it's rounded like a ball, and this is concave. So those 2 ends are going to kind of articulate that way. So when your knee bends and straightens, that's where you're getting the motion. So that's your main joint at your knee. And again, you have basically, you could draw like a line down the middle and say you've got an inside compartment and an outside compartment. The other joint that you have at your knee, if this is the outside of your knee, sitting against your tibia, you have your fibula. It goes down. So there's actually a little joint there on your knee as well. We don't get into it a lot in physical therapy because it's not usually a source of problem, but it can be because it's associated with ligaments as well. So that's your second joint. The third joint would sit on top there, and that would be your kneecap. So your kneecap is going to sit on a groove. If we were to draw it, it'd be like right around here, which we can just add it if we want, like that. So there's your kneecap sitting on top, and there's a groove in the femur that your kneecap is actually tracking back and forth in, and that's also a joint. So those are your 3 joints, that one there, and that one there. In terms of the fluid inside your joint, so like if you got swelling inside your joint, the fluid is continuous throughout all 3 joints. So even if you have a problem, say in this little joint here or up here, it's going to cause swelling throughout your knee. When you look at joints, you start thinking of cartilage too. So the ends of any bones in a joint are going to be covered in cartilage. Cartilage is what you're going to associate later on in life, or hopefully later on and not too early in life, with arthritis. So when your cartilage starts to fade away, gets worn out, and you get down to the bone, that's arthritis. If you were to look at an x-ray on a knee, you would see like a nice space here between the femur and the tibia right there. With an arthritic knee, that space would shrink. And if you've heard of someone say, I have bone-on-bone arthritis, that's basically that happening, where the arthritis is all the way worn away, and now those bones are just sitting on each other. It could just be the inside compartment, it could just be the outside compartment, and a lot of times just both. So that's the first structure you want to be aware of in the knee, is the 3 joints. The next thing you want to be aware of then are the ligaments. 4 main ligaments that we talk about with the knee, although there are some other little ones as well, but these are the ones that you most commonly hear about being injured or strained or pulled, things like that. So on the inside of the knee, connecting the femur to the tibia, should have got different colors here, you have we call that one your MCL. On the outside, going down about like this and actually contacting the head of your fibula there too, is your LCL. Stands for medial collateral ligament, lateral collateral ligament. You probably don't need to know that, but just in case you're curious. And then on the inside, you have 2 very important ligaments. You have your ACL and your PCL. So you hear about ACLs a lot with different types of sports injuries or skiing injuries. They're just small ligaments, like the size of your pinky at most. But when they tear, big trouble in the knee because you lose stability of the knee. So basically, those ligaments on the outside of the knee are keeping your knee from kind of like stressing or bowing in or out just by the location alone. And those 2 ligaments on the inside of your knee with your ACL and PCL, they do guard against some of the rotational movements in the knee. But then primarily when you see like an ACL injury, it's a forward, like shearing movement of the lower leg. The tibia is shearing forward in relation to the femur, and that's when the ACL pops. If see like a football player hit from behind and their knee just goes forward, the ACL is just toast. Or if you're skiing, and a lot of times skiers will just kind of fall over just standing there, and their boot is so rigid that their tibia is held solid, and then their femur moves backwards, which is basically the tibia going forwards, and it pops the ACL. So those are the ligaments you want to be aware of. The other thing you want to be aware of with the knee is your muscles. Various muscles. The most common one that we talk about with knee pain is your quadriceps muscle group, which, as the name implies, with quad is actually a group of 4 muscles. So this is the biggest set of muscles in your body. So this is coming down on the front of your thigh. So the front of your thigh, this quad muscle is coming down, and then it's actually going to engulf the kneecap and then continue down here as your patellar tendon, and then it's going to attach right here on the front of your tibia. So again, coming down here, it's going to engulf the kneecap. There's your patellar tendon. So you can feel your patellar tendon down here. Just if you go underneath your kneecap, you can feel it kind of squishy there in the front. That can rupture or sprain, tear on people. And then you can have issues with quad tears and things like that. Most common what we see with the quad is weakness in the quad that's going to lead to pain in your right around your kneecap, which I'll get to at the end of this video. So you've got a lot of muscles surrounding your knee. On the back of your knee, you have your on the back of your thigh, you have your hamstrings muscles, which do cross the back of the knee. You also have your calf muscle, your gastroc we call it, which crosses the back of the knee as well. So all of these muscles are kind of influencing the knee and interacting directly with the knee. So you've got your joints, your ligaments, your muscles. There's also some other structures you just want to be aware of. On the inside of the knee, you've probably heard this term if you've had any experience with knee pain, you have meniscus. So meniscus, if you look down like an aerial view at the tibia, which basically again is kind of like a concave cupped surface like that, you have an inside and an outside compartment, which you have on those kind of rounded structures on the femur. So those are sitting in these little cups. Around the outside are your meniscus. So think of them as like a soft tissue ring. So the ring helps kind of deepen the joint a little bit, provide some stability, and it's fairly common to get a tear in your meniscus, like a small tear, and you'll feel like your knee kind of catches and maybe locks at times. It can be a lot of popping and crunching too. Doesn't necessarily mean it's a meniscus if you have noise in your knee, but if it's like catching and painfully like locking, a lot of times that's a meniscus just getting in the way of the joint and needs to be either smoothed out or surgically repaired. So you have your meniscus. The other common one that you hear about with knee pain is your IT band or your iliotibial band. That's going to run along the outside of your thigh. If you put your fingers along the outside of your thigh, it's real tight there. So that's your IT band. So IT band tightness can influence the tracking of the patella as well, because if it's tight on the outside, it's going to pull your kneecap towards the outside. So just some various structures there to be aware of. Again, when you're looking at dealing with knee pain, you want to know what you're getting into, what could be going wrong and what could be going right, things like that. That all being said, the most common type of pain we see in the clinic is what we call patello-femoral joint pain. So that's one of those 3 joints, the patello-femoral joint, which is basically where your kneecap is sitting on your femur in a little groove. So picture like a little shallow groove, and as you bend and straighten your knee, that kneecap is gliding up and down in that groove. So what we typically see then is with knee pain, you get a lot of tracking issues with the patella, particularly that patella, the kneecap, is going to start to track to the outside, and that over time causes a lot of pain and irritation under that joint, because when it tracks towards the inside or in the middle where it wants to be, it has nice basically wearing or distribution of those 2 joint surfaces, so it's comfortable. So you're not just putting all of the force through one side of the joint, it's going through the whole joint at once. So that's nice and comfortable. So when the kneecap starts to track to the outside, you're just going to be riding along one portion of the joint. It's going to wear on that cartilage on that specific area, and it's going to cause irritation. So that's your patello-femoral pain. So the most things you're going to see in common or causing patello-femoral pain are weakness with the quads, especially this inside portion we call the VMO. VMO weakness is going to have a negative impact on the tracking of the patella. Hip weakness, so up here somewhere. Hip weakness is another common cause, because as your hip gets weak, the alignment of the femur coming down tends to go more towards midline. Think of like a knock-knee position. So weakness up there is going to cause problems. You could go from the ground up and say if you have an ankle, especially one that's a really flat foot, and we call it pronation, but you can think of it as kind of like a flat foot where it's rolling down towards the ground. That's going to take your tibia and move it more towards the midline, and that's going to affect the tracking again of that kneecap. And then another thing you see with patello-femoral pain is tightness in your IT band. So when you're looking at that type of pain, you just want to be aware of checking all of these different structures, and obviously ruling out things like any MCL, LCL, ligament involvement, things like that. You just have to rule out a bunch of stuff. which isn't a big deal as a PT, but if you're trying to do it on your own, could be a little trickier just because obviously there's a lot to think about. So IT band, again, can be on the outside causing a tracking issue. So that's the most common type of pain that we see. I've got a video and a blog about the top 5 exercises you can do to treat that type of pain. So I know this video is getting long, I apologize, a lot of stuff to cover, but I've got one that just shows you the top 5 exercises that you can do to start working on that type of pain. So hopefully this gives you just an idea of what you're dealing with when you're looking at knee pain and all the structures that could be involved that, again, usually you just want to know them so you can kind of cross them off your list and just exclude them from being a possible source of your pain. And then you can target what's causing your pain, and you do want to pay close attention to your ankle and your hip because they are below and above the joint, so they can directly influence the alignment of the joint. So hopefully that helps you just get an understanding, if not feels overwhelming, but check out the next video too with, again, top 5 exercises for Patello-femoral joint pain, and hopefully that'll help you out. And as always, if you have questions or comments, I'll leave all my information below the video. You can call me, you can email me, just let me know what you have. So there you go for today. Thank you for watching.